In this lesson, I'm going to teach you the techniques used by all healthcare providers. And that includes first responders such as paramedics, firemen, nurses, and really just about anyone who's trained and certified with a level HCP. In this first scenario, a casualty requires CPR and AED. First, do a primary survey. The first rescuer assesses the breathing, while the second rescuer sets up the AED. Assess breathing by doing a head-tilt chin lift. Listen for breathing. Feel the breath on your face and look to see if the chest rises. Also check the carotid artery for a pulse. Do this for 5 seconds, but no more than 10 seconds. If not breathing, immediately perform CPR. Compress at a rate of 100 to 120 per minute and 5 to 6 centimeters for an adult. For a child, compress 5 centimeters deep. For one rescuer CPR, it's 30 compressions and 2 ventilations. For 2 or more rescuer CPR, it's 15 compressions and 2 ventilations. At this point, the rescuer should have the AED set up and ready. For an adult, place one pad on the right, slightly below the collarbone, and the other pad on the left, slightly above the lower rib cage. For a child, apply one pad to the front and the other pad to the back. If you forget, just look at the pads. All the pads will have a picture of the correct position. Follow the voice prompt of the AED, and it will tell you when to analyze, when to shock, and when to continue with CPR. If a third rescuer is available, then she will manage the BVM. In this scenario, we're going to talk about an infant who needs artificial respiration. So first, you're going to check responsiveness. And to check responsiveness of an infant, you're going to tap on the sole of the infant's feet. Assess breathing by doing a head tilt chin lift, but be very gentle because it's an infant. Also check the brachial pulse. If there is pulse but no breathing, give artificial respiration. Okay, so this is a better picture of how to hold the BVM against the casualty's mouth. The thumb and the index finger form a C position, and then the rest of the fingers form an E position, and that's how you make the tight seal, by grabbing onto the casualty's jaw area with your 3 fingers. That forms the E position. Tilt the head slightly up and squeeze the bag every 3 to 5 seconds. Be careful not to over squeeze and force too much air into the lungs. If there are two rescuers share the responsibility, this will allow rescuer 1 to use both hands. That way you ensure a tighter seal. In this scenario, the infant requires CPR and AED. Again, you're going to tap on the sole of the infant's feet to assess responsiveness. And then you're going to assess breathing for 5 seconds, but no more than 10 seconds. If there's no breathing and no pulse, you immediately go into CPR. Compressed at a rate of 120 per minute, so absolutely nothing less than 100 per minute, and a depth of 1/3 of the infant's chest. For one rescuer, it's 30 compressions and 2 ventilations. For 2 or more rescuer CPR, it's 15 compressions and 2 ventilations. Again, notice how the person continues the CPR while the pads are being applied. Once the pads are applied, just follow the voice prompt of the AED. It will tell you when to analyze, when to shock, and when to continue with CPR.